Hi everybody, Nelson Virtual here with ExcelMale.com. I'll be speaking today about the role of estradiol in men. It's a very confusing subject, a lot of misconceptions, a lot of wrong information on different online forums, not on ExcelMale. We do discuss every single study. I tend to be very conservative when it comes to the topic of estradiol. I think a lot of clinics are treating estradiol too aggressively. They're crashing men's estradiol, which is not good. I'll be showing some data on what happens when your estradiol is too low. And I think most men do not need to be too concerned about estradiol. The body actually keeps a balance between testosterone and estradiol. And unless you have health issues like liver disease, or extreme fat content, most men, or a genetic mutation, most men do not really overproduce estradiol. Some men are very concerned about estradiol since it's being vilified online, like the evil hormone, female hormone, that causes water retention, erectile dysfunction, gynecomastia. But in fact, a lot of these symptoms have nothing to do with estradiol. They're all related to other issues related to either testosterone or other health issues. So obviously I have very strong biases, but estradiol, as I said, excessive estradiol can obviously cause some issues when it comes to cardiovascular disease and yes, in growth of the mammary gland and cause gynecomastia related issues. So I'm not saying estradiol is all good. Obviously, nobody has really proven that estradiol, high estradiol causes anything in particular. There's only one study I'll be talking about. So let's review the data that we have in different studies. You can also find more information on ExcelMale.com since I have a very long post there that goes through all the data that I'll be showing today. Estradiol is produced from the conversion of testosterone through the aromatase enzyme in the liver and in fat cells, mostly subcutaneous fat cells under the skin. It has, as I said, benefits and target tissues like the receptors, estrogen receptors in the brain, in the heart, obviously in the breast tissue, in the mammary glands, liver, in the reproductive tract in men and women, and in bone. So estradiol is needed for bone density health, for reproductive and sperm production, and ovary production of the eggs, liver metabolism, cardiovascular health. There is some role of estradiol in lipids, and also mood and sexual function. Okay, so estradiol is very important. It is hormone associated with females, so men think that is not a good hormone for them. But like women need testosterone, men also need estradiol. Otherwise, nature and evolution would not have put it downstream from testosterone. So really, testosterone is a precursor of estradiol. All right? And this is hopefully not a too complicated diagram of what happens with the hormonal cascade in what we call the HPTA axis, or HPT axis, hypothalamic, pituitary, testicular glands. The hypothalamus, right in the brain, sends a signal called it's basically a hormone called gonadotropin releasing hormone that tells the pituitary gland to produce luteinizing hormone and follicle stimulating hormone. These two hormones work on the Leydig cells and the germ cells in the testicles to produce testosterone or sperm. Once testosterone is produced, most of it is actually metabolized and discharged from the body. And some of it becomes free testosterone or bound testosterone to albumin or sex hormone binding globulin. Testosterone converts, 0.3% of testosterone converts to estradiol in healthy men. Around 6 to 8% converts into DHT, dihydrotestosterone. DHT is linked to sexual function, mood. However, excess DHT can cause increase in acne in some men, not all of men, hair loss, especially those with genetic predisposition to hair loss, and even prostatic inflammation in some men. So DHT is important once again. Excessive the HD obviously is not a good thing to have. Estradiol, 0.3% gets converted, testosterone 0.3% gets converted to estradiol, and I already talked about the benefits. So both estradiol and testosterone have been shown to send signals to the upstream glands, the hypothalamus and pituitary gland, to either slow them down or increase their activity depending on the levels of testosterone. So the body actually self-regulates and tells the HP part of the axis to either slow down or increase its rate of production. So when we increase testosterone with an injection or gels or pellets, we're basically shutting down this cascade, because the body says, well, we don't need to produce any testosterone. This guy's giving us some extra testosterone from the outside world. But as I said, this is protected. Testosterone still converts to the HCG and estradiol. We just do not have LH and FSH. The sperm production drops to almost zero, but this obviously is preserved by testosterone replacement therapy options. And this is the first study actually published in 2013 in the New England Journal of Medicine that was very well done. The researchers enrolled young men, healthy young men. They gave them a medication to shut down their testosterone and the estradiol to zero and the HD. Basically, these men were volunteering for research. And then the researchers gave them injections of testosterone at different dosages. They followed these men for a few months, measured their body composition, muscle, fat, all that, and sexual function questionnaires, etc. They were able to really, in a very clean manner, a very well done control study, to prove that low estradiol and low testosterone were linked to increase in fat mass and also decreases in sexual function, libido, etc. So estradiol on its own can do the same things as testosterone. It's an enhancer of effect, and crashing your estradiol by taking either anastrozole or any other medications that may decrease estradiol is actually not a good thing. Obviously, we know that low estradiol can also cause bone loss. So men need estradiol. Do not over-treat estradiol. Be careful with anything you do to reduce your estradiol, because you actually may lose sexual function, get fatter, and lose bone density. And there's also some cognitive issues. Very well done study. You can find out more about the study either by Googling the reference here or by going to ExcelMale, since I go into details with different graphs and other facts. Another study, this is a study that really created a lot of the hysteria around estradiol. It actually enrolled older men, around 58 years of age average, in Poland. It was an observational study, so there was really no intervention. And 501 men with kind of low testosterone. Most of them had an average, the average was around 320 nanograms per deciliter. So these men were really, by our definition in the United States, were hypogonadal. They had low testosterone. They separated the men in 5 groups, depending on their estradiol blood levels. And by the way, this study obviously used the OLT test. It's a very important thing for me to focus on right now, because I don't have a slide. The fact that estradiol testing has evolved. We used to use an old test that was based on ECLA. It's an old immuno-based testing that used to overestimate estradiol in men. Men with higher CRP blood levels tended to have overestimation of estradiol, artificially high estradiol, so people would freak out, and really we found out later that doing a test called the based on liquid chromatography and mass spectrometry gives a better indication the actual number of estradiol. But anyways, this study actually used the old test, like most research studies out there, except the previous one I showed. Actually, they used liquid chromatography. It separated men in 5 groups. Those that had very low estradiol under 12.9 picograms per milliliter, to the fifth quartile, which was men with over 37.4 picograms per milliliter. And they followed them for 3 years to see their survival rate. These men had chronic heart disease. All of them had either a history of heart attacks or heart disease. So these were not healthy men. They were 58 years old, men with low testosterone, cardiovascular issues, and they were followed to see who died, how many people died. They found obviously men with low estradiol died. Their survival rate, a 3-year survival rate, was 44.6. And men with really high estradiol, over 37.4, had also actually even a higher incidence of survival rate. The control group, really quartile 3 is really the control group because it's estradiols of 20 to 30, and they basically survived, most of them survived 82% or so. So we can tell low estradiol has a very low survival rate, meaning only 44% of the men were alive 3 years later. High estradiol, basically 65% of men were alive 3 years later. So this actually freaked some people out. We know very well low estradiol is not good for you, but clinicians started using that 37 picograms per milliliter as the cutoff for health-related issues on estradiol. It's an observational study using the old test. If we had used a liquid chromatography test, maybe it would be lower. But really, most healthy men have 20 to 40 to 50, actually, not picograms per milliliter. The higher the testosterone, the higher the estradiol. So these are men with low testosterone, obviously. Men using testosterone replacement, most of them have testosterone over 500 nanograms. Most are actually sitting around 800 to 1,000 nanograms. Should expect higher estradiol levels because 0.3% of it, testosterone gets converted. So don't freak out just because your estradiol has gone up when you get on testosterone, because it is a expected response from the body to balance the effects of and boost the effects of testosterone. This is a study, actually, an observational, basically chart review by the folks from Baylor College of Medicine here in Houston, Dr. Lipschul's group, that linked higher testosterone and higher estradiol to better libido and sexual function in men. Kind of created a lot of controversy out there because most men and clinicians think that higher levels of estradiol are bad for you, but in fact, these guys with higher levels of both testosterone and estradiol seem to be doing better sexually. Okay, so the cutoff was 50 picograms per milliliter. You can see more details on ExcelMale.com. Another study, I don't have the reference, I'm sorry, you can find it on ExcelMale.com, found that the higher the testosterone to estradiol ratio, when you divide the numbers, the better testicular function and sperm production. So men that actually impregnated wives tended to have testosterone to estradiol ratio of 14 and above. And those that did have problems with having pregnancy effects did have low testosterone to estradiol. So what does this mean? Should we following up men by dividing testosterone to estradiol and seeing the ratio? There's no real agreement. I don't think any doctor really follows the ratio. Most studies don't. I'd like to see more data, obviously, on the ratio of testosterone and estradiol. Is that really the most important factor to follow? Since testosterone goes up with estradiol, is the ratio really the most important thing to look at? We have no data, so hopefully if any investigators are watching this video, this is a good thing to follow in a research study. Measure testosterone and estradiol, give people different doses of testosterone, and follow them for a few years and see who has better body composition and or sperm production and or sexual function. That'll be a great study. So what happens when either young men or old men use testosterone injections? What happens to their estradiol? You probably won't be able to see this graph. It's very busy is from a study published in 2010 in the Journal of Clinical Endocrinology and Metabolism. This study, once again, shut down blood levels of testosterone in older and young men and started giving them testosterone enanthate at different doses, anywhere from 25 milligrams a week up to 600 milligrams a week. Very low dosage to a very high bodybuilding type of dosage. The white bars are old men and the black bars are young men. All right, so this is total estradiol. As obviously as the dose increased, estradiol increased, that's obvious. But it actually increased a lot more in older men. No, they couldn't really explain if it's the fact that they didn't do body composition analysis, but was this the fact that older men have usually more fat mass, or even medication-induced liver dysfunction that could be causing more aromatization. But it is a very interesting observation that older men tend to produce more estradiol per milligram of testosterone than younger men. This is actually DHT. DHT was not very different. DHT production by young and older men was basically the same at different dosages. And this is something we hardly measure, which we should look at, is a free estradiol, the estradiol not bound to sex hormone binding globulin. And something that most of us don't think about, the fact that estradiol, like testosterone, gets bound up by sex hormone binding globulin, and some of it is free and some of it is not free to do the job, or do the effect. So actually, the higher the testosterone dosage, the lower the free estradiol, which is very interesting too. It seems like the higher the dose of testosterone, the more estradiol gets bound up. So this is pretty clear. I mean, older men obviously produce more than younger men when it comes to different dosages. And when it comes to DHT, we don't seem to see a difference. Of course, there is an increase per dose, which is expected too. So symptoms of estradiol excess, very controversial too, because there's actually little to no data on most of them. Nipple sensitivity. Testosterone increases the sensitivity of the nipple area in many men. Some men actually freak out. They think it's they're going to get gynecomastia. And nobody has really studied whether sensitivity in the nipple area has been linked to a higher incidence of gynecomastia. So that's one of my doubts. Fluid retention. We are assuming, because we're coming from data in women, that higher estradiol can cause PMS-like symptoms and bloat. There is not a single study in men that actually proves that. We're speculating, we're assuming, some people rightly so. I don't believe that the edema or water retention caused by testosterone has anything to do with estradiol. There are other effects. I'm going to be covering that in another video of why that happens in a minority of men. Elevation of blood pressure related to the water retention. That could also be an issue that has nothing to do with estradiol. Decreases in libido. We found, obviously, that low estradiol can decrease libido. We have not one single study that shows that high estradiol causes decreases in libido. We just don't have any data. We're just speculating. So anytime you hear that, it's basically a speculation. Probably the right one or probably the wrong one, but I believe the data is important. So we have to educate about the dosing of anastrozole. Anastrozole is a drug, the brand name is Arimidex, that can decrease estradiol. And some men call their doctors or their clinics when they're having sensitivity on their nipples and they start freaking out. The doctor may actually choose to put them on anastrozole low dose. What I'm seeing the most on ExcelMale.com is that men are being overdosed. They're being with anastrozole. They're coming in saying that their doctors are putting on 1 milligram a day or 1 milligram of anastrozole 3 times a week, and obviously their estradiol is 0, and they're feeling all the symptoms of low testosterone, even though their testosterone is high because they're using injections. So that's my main concern. It's happening a lot. So for the clinics out there, hopefully anybody watching this video, please stop doing that. If you're going to treat a man, starting very low dose, 0.5 milligrams a week maybe, and retest estradiol 4 weeks after you do this to make sure the person, the man, does not have estradiol under 20 picograms per milliliter. Some men may need 1 milligram a week. Most men do not need anastrozole. I have never taken anastrozole in 25 years. So obviously I'm not a high estradiol producer. I've never had gynecomastia, history of gynecomastia. So some of us just don't have to take it if our estradiol blood levels, and even if we had, I believe that if you have estradiol of 50 or 60 and you have no symptoms, you shouldn't be treating it. But obviously many doctors in the business criticize me for that point of view. I really think estradiol blockage of the receptor eventually has long-term effects on cognitive function, bone density, and even sexual function. But that's me, so don't take my word for it. We'll probably hopefully see more data on this. It's becoming a hot topic that more researchers are looking at. Factors that increase estradiol: age, as we saw in the graph before. Older men tend to produce more estradiol, either because we're getting fatter or metabolic issues, hormonal differences, liver metabolism. Obesity, the more fat, the more aromatization in most men. Some drugs, and in this case, it's a drug used in HIV. It's actually been reported to cause gynecomastia. There are other drugs like ketoconazole that decrease testosterone, or Tagamet, it's an acid reducer, can decrease testosterone. And once you decrease testosterone, the testosterone to estradiol ratio may be going down, and that may actually cause issues with gyno and all that. Alcohol overconsumption. I mean, having 1 or 2 drinks a day is not going to increase your estradiol, but for those that are over-consuming, especially beer, some data. I have to say there's a little bit of a speculation there. Liver disease, definitely. Aromatization happens in the liver tissue. Zinc deficiency, we have, I think, one reference that estradiol does increase in men with deficiency in zinc. So some men take 50 milligrams of zinc and 2 milligrams of copper. Copper tends to balance the zinc efficacy. There's one reference on vitamin C deficiency, one reference on excessive DHEA. I'm going to show that reference right now. Zero estrogens, including plastics, IV bags, exposure to mostly plastic-related containers, and environmental toxins. That has actually been covered a lot in the media. Lavender, tea tree oil, soy consumption, flaxseed. Flaxseed actually is good. It has fiber and good oils, but excessive use of flaxseed there are 2 references on that. So the fear that, especially in bodybuilders, obviously you can tell this guy's a bodybuilder, is the increase in nipple size and the breast tissue under the nipple, which is called gynecomastia. It's pretty obvious in some men, like in this case, before and after gyno. And it can obviously get really, really bad in some men to excessive size there. Arimidex or anastrozole, some doctors also may use tamoxifen to decrease estradiol. This is actually is even more effective for really severe cases of gynecomastia. When it gets to be really severe, men have to go for surgery to remove the breast tissue, and that's actually in the worst cases. That's the only way to treat it. So anastrozole, talk a little bit about anastrozole. It is off-label, so insurance companies don't pay for the use of anastrozole in men. It's actually a breast cancer drug used in women. It's the best single reliable way to control estradiol blood levels. I'm not saying it's the best. There are actually 4 different compounds used out there. It's the most commonly used. Like I said before, zinc, copper supplementation and chrysin seems to work in some men. I really believe that that way of treating anastrozole is, I keep changing anastrozole for estradiol. Estradiol is not very effective, but I'm not going to fight against some references on the subject. Compounded anastrozole is available by compounding pharmacies, very cheap, 1.5, 0.25 milligram capsules, depending on what your doctor orders. As I said, 0.5 to 1 milligram a week is most men, that's all they need, although they're getting treated with a lot more. Many men don't need it, and patients can be instructed to take it as needed if sensitivity develops in the chest and nipple area. Although, as I said, I have doubts that that's linked, but I could have all the doubts in the world, and you still, without data, I'm speculating also. All right, so I'm going to go through this one. This is very interesting. People ask me a lot about the supplementation of using DHEA to feel better or to increase your testosterone or to improve your cognitive function. There are a lot of studies on DHEA. DHEA has not really been found to increase testosterone in men. There's some good data in women that show that it does increase testosterone in them. There's some studies that show improved cognitive function, energy levels, especially for men that have low DHEA levels. But DHEA can also increase estradiol, and if you're very concerned about estradiol, then that's something you need to know. This is actually a review of different papers, and the estradiol blood levels, this is no change, and this is increases and decreases. So most studies show an increase in estradiol blood levels using DHEA. So if you're going to take DHEA, at least have your estradiol tested a few weeks after you start. 25 to 50 milligrams a day is what people are using when it comes to DHEA. So just keep that in mind, especially if you're really, really freaked out and obsessed about estradiol, which I think some men are just obsessing a little too much. How about HCG? I get that question too. HCG obviously is used for prevention and reversal of testicular atrophy. We have some anecdotal data. I'm very biased for it. I think HCG is a booster of testosterone when it comes to sexual function. It actually has been shown to be, when you use it with testosterone, to improve fertility and sperm production and quality. So that's another benefit. I have a video that just talks about HCG. So check it out on ExcelMale's YouTube channel or on ExcelMale.com. So make sure you, after you watch this estradiol video, you watch my HCG video. So I'm going to talk about HCG and the studies. It's actually a study, once again, that looked at high doses and low doses of HCG and what happened a few hours later to estradiol. I really like studies. I'm a chemical engineer and I tend to thrive on data. It's very frustrating for me in this field because we don't have as much data as we should. However, this guy's here from the European Journal of Endocrinology, 2008, took the time to look at this. This is a study. The left-hand side, these two graphs are lower doses of HCG, 50, 500, and 5,000 IUs, only one shot. And this side of the graph is 5,000 and 6,500 IU injections. High dose, lower dose, even though, and different curves right here. This is testosterone and estradiol. 1, 3, 5, 24, 48, and 72 hours. Okay? So basically over the course of 3 days. So yes, they higher the HCG dosage, and these guys were not using testosterone, only HCG, one shot right here, one shot. So you do see an increase in estradiol. Their baseline was around something like 23 to 28 picograms. And obviously the really high dose of 5,000 had a spike. The 500 IU dose only basically spiked a little bit of estradiol a day later, 24 hours, and then started coming down to baseline at 72. So yes, if you get on HCG, especially HCG and testosterone, it is a good idea to follow up in your blood work on your blood levels of estradiol. I believe that maybe the effect of HCG on sexual function, the boosting of sexual function, has to do a lot with the boost in estradiol blood levels. Obviously, the higher doses had a very high peak that started coming down. Even at 72 hours, you see the levels not returning to baseline. So the effect takes a while. One shot of HCG at 5,000 or 6,500 IUs has an effect that lasts probably 4 to 5 days or longer. So nobody has really followed this behavior over the 3-day period. So for more information you can find once again on ExcelMale.com. This is an evolving field. We'll probably see more and more data that will either prove me right or wrong about the abuses of anastrozole estradiol management with anastrozole. And just ask anything you need to ask. And on ExcelMale.com, we have 14,000 guys on the forum. And we have 8 guys that are very much experts on the subject. They answer questions, including myself. We have some doctors too that answer questions, and pharmacists, and dietitians, and exercise trainers. So we'll see you there, and stay tuned for my next video. Thank you.